So thank you, Ale, for your words. So I'm André Fogaça, dermatologist from Brazil, member of the Brazilian Society of Dermatologists and the American Academy of Dermatologists and scientific director of MedBuild. And for today, no conflicts of interest for this presentation. For today, an overview. Buttocks treats. First, I'd like to show you PDO threads, its characteristics and histological analysis. Second, the assessment and the scale of laxity that I'm using. Then technique with a video session with simple observable monothreads in fan technique. And finally, outcomes we can see with me before and after, a year after. So let's start with the PDO threads. The PDO threads are polymer, 100% observable with a follow-up of more than 30 years in medicine. To conclude, it is biosafe for human. And when did I think of using PDO threads for body and buttocks treatment? On this chart on your screen, you can see images of the study that convinced me because histological evaluation of a biorevitalization treatment with PDO threads. See, on T0, there are fine collagen fibers before the insertion of PDO threads. And then on T1, we can see 6 months later, the collagen increase. And on T2, the amazing pink collagen mesh after a year. On T3, 18 months after the insertion of PDO, we come back to fine collagen fibers stage. There is another important study, an animal study with pigs, showing the tissue change over time after polydioxanone thread insertion. Let's take a close look. Using Masson trichrome stain, a fibrous brightening effect is observed in blue, showing collagen fibers branching out from the thread insertion site toward the dermis and the fascia in the spider web shape. Conclusions. PDO threads cause a specific change to the surrounding tissues that result in new collagenesis, a fibrous merging effect, fat reduction, tissue contracture, and an improved vascular environment. The results of this study explain the positive change described in previous clinical research. Now, we come to assessment and the scale of laxity. It was an honor to participate in this study with Dr. Doris Hexel and create this scale. There are 4 degrees of laxity in this scale. 0 degree or non-existent laxity. 1 degree or light laxity. 2 or moderate, and finally 3 or severe laxity. And in which degrees can we use PDO threads? Light, moderate, as well severe laxity. Let's now talk about the technique itself. This patient falls under the severe laxity category. And I use 5 PDO monothreads with 21 gauge cannula in 4 fan technique blocks. Why do I choose this kind of thread? Because it is the tightest of all threads with 0.0 USP, the United States pharmacopy, and ideal for body treatment. So important to know about an anatomic layer, and in case of PDO threads, the ideal anatomic layer is superficial subcutaneous tissue. And don't forget this, never and never put the PDO threads into the dermis. Let's observe the technique.
Now, I will show you the application video and how I insert the threads. First, I prepare the insertion point with anesthesia, lidocaine with epinephrine. This is the thread chosen, a 21 gauge cannulate flat thread. With an 18 gauge needle, I make the insertion for the introduction of the thread. I look for the correct plane of insertion, that is, the superficial subcutaneous cellular tissue. Now we can observe the fibrosis. We have to actually cross those fibroses. We go on by positioning our threads all through the same entry point in this fan technique. Sometimes we can even observe the formation and retraction of cellulites. Look at this. When the cannula goes through the fibrosis. Another nice important tip is to ensure the total implantation of the thread. And how do we do that? We make sure that the white rubber that holds the thread entirely touches the green cannon of the cannula. Despite the fibrosis, it is a painless application for the patient because the application to the correct plane, the superficial subcutaneous tissue, does not hurt. Then, showing you once again the correct plane. The cleaning of the pre-procedure marks has to be done in the same direction in which threads were inserted, so that it ensures that threads do not come out. Trochanteric fossa block. We follow the same technique, the same insertion point, application plan, full implantation of the cannula, and finally, cleaning in the same direction of the application. Fourth and final block, the lower buttock. And the application is entirely done with a total of 20 flat monothreads into a 21 gauge cannula.
So finally, let's take a look at the outcomes of the technique. On the left, you can see the patient before the insertion of PDO threads. The patient has a severe degree of laxity. And on the right, you can see the patient 1 year later, the applying of the PDO threads. And improvement of laxity degree from severe to moderate laxity. So we have a new tool to treat body laxity and Buttocks laxity, and you can do it too. Thank you for listening, and my contacts are on your screen. It is a pleasure to me to be here with bright colleagues. Thank you, Ale and Incas Congress.
In fact, it's me to thank you, Andrea, for this amazing presentation and this brilliant outcomes that you could reach with this thread.